but they just aren't listening. I hear this all the time from my patients, from my colleagues, even from other healthcare professionals. And here's the thing, everyone feels unheard. Patients don't feel like their doctors listen. Doctors feel dismissed by their patients and ignored by the system. Families are left frustrated trying to advocate for their loved ones. And what's the result? A whole bunch of mistrust, frustration, and a healthcare system where no one feels truly cared for. Let's talk about why this is happening and, more importantly, what we can do about it. Hi there, I'm Dr. Santina Wheat. I'm a family physician educator and a career and life coach dedicated to helping healthcare workers conquer their chaos and get to calm. And today I want to talk about a few ways no one feels heard in healthcare and how we can work to fix it. Let's talk about a few stories. A mother fighting to be heard. I experienced this firsthand as a mother. When my youngest child was a baby, she had recurrent ear infections. Every time I took her in, and every time I was reassured, she is generally developing okay. But as a physician and as an experienced mom, I knew something wasn't right. I kept pushing. I shared our family history. I pointed out her speech development didn't match her sister's. And finally, after a lot of persistence, she met the criteria for tubes. And the moment she came out of recovery, she sang for the first time. This moment for me was powerful. It validated everything I had fought for. But it also revealed a hard truth. Sometimes in medicine, we don't listen until we are forced to, and our families need to be heard. Also, a doctor turned advocate. A few years later, I found myself in the same position, but this time as a daughter. My mother needed medical care. She was sick, and I watched as her concerns were dismissed. No one was listening to her or to me. She was well educated. This was not a case of poor health literacy. It wasn't until I introduced myself as a physician that people started taking me seriously. And that was heartbreaking. And it made me question, why should my credentials as a physician matter more than my voice as her daughter? And now for some, I am the doctor who isn't listening. Fast forward to today, and now I'm the one being accused of not always listening. Sometimes patients come in with expectations, tests they want, treatments they've researched, and when I explain why a test isn't necessary or why an intervention may cause more harm than good, they feel dismissed. I see it in their body language, and it makes me feel horrible, especially since I've been on the other side. But here's the challenge from my perspective. Listening does not always mean agreeing. As physicians, we aren't just here to hear concerns. We're here to integrate them with our medical knowledge, our evidence-based guidelines, and what we know will provide the best care. And yet, our patients often assume that if we don't act the way that they expect, we aren't listening at all. And while sometimes this might be true, most of the time it isn't. So everyone feels unheard. And why does this happen? Our patients feel rushed and ignored in a system that values efficiency over connection. Our doctors are drowning in administrative burdens, making meaningful conversations harder. Our families are forced to fight just to be taken seriously. And the rise of misinformation has made trust in medicine more fragile than ever. The disconnect is real, but we can do something about it. So how do we fix it? How do we bridge this gap? How do we truly listen while still upholding the integrity of good medical care? Well, here are a few steps that we can take. First, we can control our own responses. We can't control how others perceive our words, but we can control how we deliver them. We can approach conversations with empathy and clarity. These are both key. Second, we can set clear boundaries. Physicians can't always give patients what they want, but we can explain why we make the decisions that we do, and that transparency can build trust. Third, we can explain our thought process. Patients may feel unheard because they don't understand why we recommend or don't recommend certain things. Sharing our reasoning can help. And then fourth, we have to accept that not every patient-doctor relationship will be perfect, and that's okay. Sometimes we cannot fix that relationship. And there is a path forward. If we are all feeling unheard, the solution isn't to speak louder. It is to communicate differently. Because at the end of the day, healthcare isn't just about diagnoses and treatments. It is about relationships. The relationships between patients and doctors, the relationships between families and care teams, and even within the medical profession itself. If we can find better ways to truly listen to each other, to our patients, to our colleagues, maybe we can start rebuilding the trust that healthcare so desperately needs. Now, if you have ever felt unheard in healthcare, whether as a patient, a family member, a physician, or other healthcare worker, I would love to hear your story. Drop a comment below. Let's start this conversation. Take a few moments to also read the piece that I wrote for the So Me Docs magazine and let me know if it mirrors your experience. And if you are a healthcare professional who is struggling with balance, burnout, boundaries, or even chaos, I have resources to help you, and let's connect. And I hope you will like, share, and subscribe if this message resonated with you, because this is a conversation we need to keep having.